World AIDS Day 2016 comes over a year after the community of nations committed to ending AIDS by 2030 as part of a Sustainable Development Goals, and 6 months following a landmark political declaration to end AIDS. HIV prevention is central to achieving this goal. At this exciting moment in history, we have at our disposal a combination of new science, evidence-based prevention strategies refined over more than 30 years. Some of the weapons in our arsenal are familiar. Condoms still matter. Our governments have committed to ensuring that we have strengthened national condom programs with sufficient attention to procurement and distribution. We have learned over the last 2 decades how to use social marketing to target specific audiences and to drive demand for condom use. Our region also knows how to prevent babies from being born with HIV. Through the widespread expansion of antiretroviral treatment for mothers living with HIV, there have been dramatic declines in HIV transmission to children. In 2015, 9 of every 10 pregnant women living with HIV in Latin America and the Caribbean received antiretroviral medicines. I remember when, in 2008, the Ministers of Health and the Ministers of Education from Latin America and the Caribbean committed to providing young people with comprehensive sexuality education through the Education to Prevent Declaration. We must now ramp up our efforts to ensure that adolescents have that education, along with access to economic empowerment and sexual and reproductive health services. Today, happily, we have new tools to bolster HIV prevention. Pre-exposure prophylaxis, or PrEP, HIV drugs taken by an HIV-negative person on a daily basis, dramatically reduce the chance of contracting the virus. The world has agreed to reach at least 3 million people at higher risk of HIV infection with these preventive drugs. Many governments in our regions have come on board. Early HIV testing and treatment can be game changers as well. We now know that the sooner a person living with HIV finds out their status and starts treatment, the sooner the levels of the virus in their blood can be reduced, nearly eliminating the risk of infecting somebody else. It is on this basis that governments have committed to achieving the 1990 targets. That is, 90% of people living with HIV are aware of their status. 90% of them are on treatment, and 90% of the ones on treatment are virally suppressed. Perhaps the greatest challenge is our ongoing fight to eliminate stigma and discrimination. Even where we have combination HIV prevention services available, too many people do not feel safe or do not have the means to access these services. The success we have achieved so far gives us hope for the future. But as we look ahead, we must remember not to be complacent. AIDS is not over, but it can certainly be.